You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, new treatment options for people with varicose veins or even small, tiny spider veins. With us, we have an expert on the topic. He is Orange County's leg doctor, Dr. Siddiqi. Dr. Siddiqi, welcome to the program.
Hi, Randy. Thanks for having me.
Now, you are a board-certified interventional radiologist.
Correct.
Right? And now I guess you've restricted your practice to just leg veins. Is that right?
I still practice interventional radiology. However,
Okay.
I really want to focus in on legs. I've found that there's a number of people that have arterial and venous disease and just aren't being taken care of properly. So what we've done is create and established a center of excellence for legs. We'll take care of arterial disease, we'll take care of venous disease, we'll take care of cosmetic disease.
So who is the typical patient that sees you?
I see a number of patients. I see a broad spectrum. I'll come in from the soccer mom or the middle-aged dad who just has some unsightly veins that they're unhappy about. They don't like the way they look on their legs. They feel as though it is something that they could improve in the quality of their life so their appearance is better. I'll see a patient who comes in with aching, throbbing legs who really has been uncomfortable for a number of years, just didn't know who to go to. And then I'll see some patients who really have bad venous disease or have bad end-stage arterial disease, who've suffered with the disease process for a long time and for one reason or another just haven't had it taken care of. And they'll get referred to me and then we'll help them out. We'll help them feel better.
Now we talked on the phone. You say that some people, that you just eliminate the veins on their legs and their life changes, or you change their lives. Elaborate on that.
So when a patient comes in, the veins in their legs is the obvious thing that's bothering them that they can see. But they also have emotional things, emotional connections that are taking place. If you have pain, if you have suffering, by eliminating that vein, we can make that leg feel better and make you feel better as a whole. If you have spider veins that make you embarrassed about yourself, that decrease your self-confidence, we can help you feel better that way too. I had a tennis professional that came into me once who would teach children how to play tennis. And for years, she continued to wear pants and had a difficult time in Southern California wearing pants all the time. So now, after she got treated, she feels comfortable, she's reassured in the way her legs feel, and she's out there on a daily basis. She's playing, she's running, she's helping these kids change her life, change the life of kids that she's helping out as well.
Okay, good. So people come to you for, I guess, for having to get better looking legs.
Correct.
For cosmetic reasons.
Correct.
And then other people are in pain or they have ulcers.
Yes.
Is that right?
So venous disease has a spectrum.
Okay.
When you first develop venous disease, you'll start to develop a sense of heaviness. Maybe you'll get an aching, swelling of the legs as the day goes on. That can then progress into getting spider veins or getting reticular veins or varicose veins, if you will. If you don't take care of venous disease at this point, Randy, it may or may not propagate. If it propagates, it can go on to getting large swollen legs. It can go on to getting ulcerated disease in the legs. You can get thrombophlebitis or clots in the veins. And at any way along that process, if we can help those patients, we'll reach out to them, identify those patients, and make them feel better and get the disease process under control.
So people that have big leg veins.
Yes.
For the most part, are those people, they have tired legs? That means that if you were able to take care of that, they wouldn't have tired legs?
Yes, exactly right. So normally by the time you've gotten to big, dilated, ropey veins on your legs, you've gotten towards end-stage venous disease. You've got venous hypertension. You've got edema and swelling in the legs. You've got pain in the legs. You've got one leg or both legs that's swollen. Maybe the skin is starting to get thickened or starting to get harder. You're just generally unhappy as a whole. Really, these people, if they knew how to treat their veins, they would have had them treated years ago.
So when you get rid of these veins, right? And you're not doing this in the operating room.
No.
This is an outpatient procedure.
In office, correct.
How soon do they feel better?
So they'll feel better the day of the procedure. When they come in, they have venous reflux disease. Once we ablate the vein or we cause that vein to close down, we'll wrap them. The wrap will decrease the edema. They will symptomatically start to feel better a week to 2 weeks after the fact.
Now you brought some photos.
I did.
Are these typical kind of things you see in your practice?
On a daily basis.
All right.
Allow me to share with you one gentleman. This is a gentleman who is an avid golfer. He went out, played golf his life. He worked his entire life, and he comes to retirement. He has these grandiose plans of wanting to go out, to enjoy his retirement, play golf on a daily basis with his friends. He's got a group of 4. He loves playing with them. His legs hurt. His legs look
they're
like
tired?
this.
I mean, what's the feeling?
So he feels heaviness. He'll start out a round of golf in the morning and be perfectly fine. As the day progresses, he'll start to have a heaviness, a sense of fullness in his legs. Mm-hmm. And what'll really happen by the end of the day is he'll be in pain. He really will be in pain to the point where he has a hard time walking from the golf cart to the hole.
So the golfer is tired at the end of the day, hears about you, goes to see you.
Right.
And when you see this, what are you thinking?
Right. So he sees the venous disease. He sees these dilated veins that are on his legs. What I see is an underlying disease etiology. When you come to my office, I need to make sure that I don't just treat what you can see. I want to treat the entire leg. You'll get an ultrasound done. We'll make sure that you don't have problems with underlying large vessel disease. And then we'll treat the entire patient. We'll find out what the problem is. If it's just a sclerotherapy case, we'll just do sclerotherapy.
So what did you do for this guy?
So Randy, years of pain were taken care of by a 30-minute procedure in the office. It's called EVLT, endovenous laser ablation. We made a little incision. We put a catheter inside the blood vessel that wasn't working properly, and we ablated, or we removed that blood vessel.
So are you collapsing it with the laser? What are you doing?
We are. We heat the vessel up, and as we heat the vessel up, the blood vessel walls get sticky. When they get sticky, with compression over the course of time, they fuse together. And once they fuse together, they no longer reflux, and his symptoms will go away.
Okay, so what's the follow-up with him?
So the follow-up with him is he comes back in 2 days after the fact to make sure he's doing okay. Then we follow up with him
Does he already
again.
feel better, by the way?
He feels better. He's
so
already
this is the
feeling
golfer
better.
with the tired legs?
Correct. Now, he has a compression wrap on his bandage, like an ACE bandage. We wrapped his leg with an ACE bandage after the procedure. 2 days later, he comes in. And then 2 weeks later, he'll come in again. And at 2 weeks, we'll take the bandaging off. He'll go back to regular activities. There's really not much of a restriction either during the procedure or just after the procedure. I actually want the patients to walk. I ask them to walk 2 times a day, 15 minutes at a time, immediately post-procedure, and for those 2 weeks before they come into me. So I want you out with your family. I want you having dinner.
So no more tired
shopping.
legs at all?
No, you'll start to feel better from day one. You really will. It's a wonderful experience.
Did they say, why didn't I do this earlier?
Oftentimes they'll ask me that question.
And insurance covers this.
Insurance
for
does
the most
cover
part, right?
There's a few loopholes we have to jump through for insurance, but insurance does cover it.
You were saying that there's tens of thousands, 500,000 people, just even in California, that have these leg veins that are making their legs tired or itchy or whatever, restless legs at night, that are doing nothing.
Right.
And so now I'm around and I'm seeing it at the gym. I'm seeing it all over the place.
So I'll tell you, Randy,
Do you see it too?
I do see it all the time. I was at Disneyland the other day with my family, and I see these people walking around. They've got these large veins. And I see the same people there. By the end of the day, I see them sitting down, their legs up. They're unhappy. Now, granted, they may be just like me, frustrated from the day. But also, they've got venous disease. That causes their legs to hurt. Whereas I can power through and I can watch the fireworks at the end of the day and really just have a great day. By the end of the day, people with venous disease are in pain. If they come in to see me, if I can ablate those veins, they will spend the entire day at Disneyland, just be tired from the day, but have a great time.
So you're using a laser most of the time when you're getting rid of these veins?
We are, Randy. It's a state-of-the-art treatment. Endovenous laser ablation is using a laser to heat the blood vessel up. In days gone past, people would oftentimes strip the vein or literally go in, physically grab the vessel and rip it out from the leg. Very painful, lots of downtime, 2 weeks easily of pain post-procedure. You can also use sclerotherapy for the smaller vessels.
What's that, injecting the veins?
It is. We take a very small needle.
You still do that?
We do, for the right vessel. So you have to find the vessel that's diseased, and you have to treat the vessel that's diseased. If it's a large vessel, we'll use ablation. If it's a smaller vessel or a mid-sized vessel, we might choose laser. This is a topical laser that goes on top of the skin. Alternatively, if we have a very fine vessel, we may choose to use sclerotherapy, which is...
So it's spider veins,
correct.
Smaller veins.
The very small spider veins. And it's a needle about the size of a human hair that we put inside the blood vessel.
So you brought more photos. What are we looking at?
Did, Randy. So I'm going to show you, this is a great story. This is a young lady whose daughter was getting married. And she went to go see a plastic surgeon to have her veins taken care of so that she could wear a dress and she could be happier and look better at the wedding. The plastic surgeon saw her veins and then guided her in my direction. And when we saw the patient, we realized that she had venous disease. It wasn't just the varicose veins she could see, but she had an actual disease that was treatable. So Randy, she's an attractive young lady in her 40s. And she wants to look better for the wedding. And she wants to wear a dress. She wants to wear a skirt and not be conscientious about the way she looks. After she saw the plastic surgeon who referred her to me, we realized she had vein disease. And with her vein disease, what we did was we ablated the vein by simply heating up the vessel with a laser inside the vein.
Okay.
We wrapped her legs. Those varicose veins went away. She came back a day or so after the procedure. We did sclerotherapy for smaller spider veins you could see. She was able to go to the wedding. She had renewed confidence in herself. She did not have any of the symptoms of pain, swelling, or discomfort by day's end. and she had a great time at her daughter's wedding. And this is the great thing about this story. She came to me for cosmetic reasons, but she actually had symptoms. She didn't realize that her uncomfortable legs, her heaviness, swelling, and pain was due to venous disease. She just lived with it. So when we took care of her veins, not only did she look better, but she felt better. She was able to dance the entire night at her daughter's wedding. She wore her skirts. She was confident. She was very happy with the procedure.
So this is very common. Women in their 40s with these big veins? Because I never see it.
Absolutely, Randy. Women in their 40s, 50s, 60s, 70s, men will also get it. Approximately 50% of people have some component of venous disease, and they'll cover it up. They'll hide it. So you're not going to see who else has venous disease. You simply won't see. You'll suffer. You'll have uncomfortable feelings. You'll have pain and swelling.
So there are people that have like big veins, right, on their legs, but they're saying, hey, my legs are fine.
Right.
They don't hurt. They're not tired. Is that possible? To have varicose veins and have zero symptoms?
More often than not, it's the fact that you become accustomed to the discomfort you're feeling. If you could think back 10 years ago, before you had those symptoms, the slight heaviness, the slight itching, the slight discoloration, you would notice a difference. But as time progresses, you slowly start to accommodate and accept the fact that this is the way my legs are. If we treat those patients that supposedly have no symptoms, they will feel better. They may not realize they have those symptoms, but they have symptoms. So I have another example for you. This is a attractive 30-year-old young lady who came to me because she just had her first child. And after she had her child, she developed these unsightly spider veins on the back of her knee. We evaluated her. She had no symptoms. She had no pain. She had no swelling, just these spider veins.
Just for cosmetic purposes?
Just for cosmetic purposes, absolutely. But it bothered her. Attractive young lady, and this was on her legs after her child. So she came in. After 2 sessions of sclerotherapy, we were able to get those veins to decrease in size and decrease in color. And now she looks like this. Serenity, you'll notice there's a little bit of discoloration there. This is 3 weeks post-procedure. That discoloration will go away. But if you notice, the veins are almost completely gone now. Serenity, most of the people do nothing, and they accept veins that look like this and accept their lives. If she didn't see me, this would progress. The venous disease would continue on. And I've got another example here of a young lady who did not get her veins taken care of. And this is a very interesting young lady. I'll kind of bring the two stories together. This is a mom, a different patient. Her and her daughter came in to see me because the mom's feet look like this.
What is that?
This is venous disease that's in the feet and in the ankles.
So is this like a circulation problem?
It is, absolutely. Absolutely. Blood.
So there's a blockage that you're unblocking?
Well, the blood returns back to the heart through the veins. And what's happening is her valves aren't working properly. And if the valves aren't working properly, the blood's not moving in the right direction. As that blood stays in the wrong direction, the vessels start to leak and you start to notice discoloration, larger veins, and varicose veins. Just like this. So Randy, here's how things like this are normally treated. They come in to see a vein doctor like myself. We ablate the vein. We take care of the smaller spider veins with sclerotherapy the same day the procedure. Over the course of the next 2 to 3 months, they'll come back in and see me 1 to 2 times. We'll make her feel better about her legs. We'll make her legs look better. Now, interesting story. That same lady we just saw, her daughter came in with the mom. And the daughter had a few small little spider veins. We treated her right then and there at the initial time, and we're going to avoid that daughter from getting to that point. So another thing I want to point out to you is she had incredible discomfort and pain over the course of 20 years. And she just simply didn't realize that by taking care of these veins, her pain would go away. She used to be a flight attendant on an airline, and she wore compression hose the way she's supposed to, but her venous disease progressed because she had underlying large vessel disease that nobody treated.
Is it painful to get this done?
It's really not, Randy. You know, we apply topical numbing medication and we give lidocaine. And the little tiny sticks with lidocaine are probably the most painful portion, just like if you went to the dentist. Once you put the laser inside the blood vessel, there should be no pain at all.
All right, so you put the laser in, this gets cleaned up, and she feels better. So she can walk, there's no burning or itching or whatever?
As you mentioned before, we want them to walk immediately after the procedure. There is no pain associated with this that would cause them to not be able to walk around. Burning, no. Inflammation, no. These patients feel better. They do.
Okay, good. You have more photos.
I do have some more wonderful photos I want to show you. You know, we talked about a couple of things. This is a great example of a dad who had varicose veins, lived with it. It wasn't a problem.
I see stuff like that here and there at the gym.
Absolutely. This actually is a gentleman that works in the building that I have my office in. And he had a hard time playing with his kids after work because his legs were uncomfortable. They were just painful. He came in, I saw his veins, we took care of his veins. He's outside now playing soccer, playing baseball. He's running with his kids, riding bikes after work, has a great time.
So is this for you, and I'm sure there's a lot that goes into it, right? But for you, this is an easy one to take care of.
You have to give respect where respect is due, and every patient deserves the attention they have to have.
Okay.
But yes, this is an easy one. This is a home run.
So what's your message then to guys, to women? Maybe they see their parents, their grandparents with these big veins.
Right.
Insurance covers it.
Yeah.
Tell them to come in and do something about it.
Come see the OC leg doc. We will make you feel better. The concept is simply, if you don't understand you have treatable disease, you live with the symptoms. If I can help you understand what's going on, and my goal is to help a patient understand the process, we can make you feel better, we can make you have a better life, we can make you feel more comfortable.
Can they be too far gone?
No, there's really no patient that's too far
So
gone.
big, giant, ropey veins, doesn't matter the
Absolutely.
size. Okay.
Any type of vein is treatable. We start with the disease process, we slowly treat the patient, not the vein. Okay, so I want to give you another example of a young lady. This is a lady who had ulcer disease. She had disease for more than 5 years. This is a recurrent ulcer that showed up.
Is this common?
It is very common because people will have a wound, they'll go see their doctor, they'll get some type of a steroid or an antibiotic cream. Over the course of 3, 4, 5 months, and that's a long time, the wound may heal. But since they have venous disease, these wounds will recur. And they're common to recur on these patients. This is her second, I think maybe even her third ulcer that she had on this leg. She came in to see us, we ablated the vein, which again, we closed the vessel.
So there was a vein that was causing this problem?
One vein was causing the problem for that ulcer. And once we took care of that vein.
So you collapse that vein? When you say ablate,
yes,
that means collapsing the vein?
We collapsed the vein,
okay.
Correct.
So you collapse the vein, and then how soon does this get better?
Well, the ulcer also takes time to heal because once we collapse the vein, we change the oxygenation in the tissue. So as the tissue has more oxygen, the tissue heals better. This healed over the course of a month, and after the procedure, she looked like this.
And now it's less likely to come back.
It's highly unlikely for that ulcer to come back again.
Is this frustrating to you that across the country that these ulcers, what they're ankle ulcers or foot ulcers, are being treated maybe the wrong way, or they're not going to the underlying cause?
Right, I agree with you. It's the underlying cause, and that's the question at hand. If people understood that this ulcer is related to vein disease, and if they could identify the vein disease, we could save these patients years of pain and discomfort.
It seems like an easy one to understand. So medical doctors will watch this show.
Yes.
Primary care physicians. If your patients have ulcers on the legs,
right,
rather than just putting a topical
yep,
on there, like some sort of steroid, at least have them checked out.
Absolutely.
By somebody like you.
There's a number of causes for ulcer disease. You can have arterial disease, you can have venous disease, you can have diabetes that can cause ulcers. But yeah, just have it checked out. It's a simple ultrasound test.
And usually you could fix it?
We can fix the disease, absolutely. It's a very simple
How
fix.
come this is not, the word isn't out on this more often?
I think that venous disease is underdiagnosed as a whole. There's some very good clinicians out there. I think in the past, when venous stripping was the mainstay of treatment, that the discomfort made people shy away from it. But with the advent of endovenous laser ablation, with the progression of sclerotherapy, with the progression of light-based treatments across the skin, such as a pulse laser, venous disease is very treatable with very little downtime.
And if everything goes right, if you get them early, they could go in a half hour, an hour later, they're walking out of your office.
Absolutely.
Their legs look better, they feel better. And what are men worse about this? That means men put things off more, right, than women?
Routinely, men do put things off. I think it's simply because women will notice the cosmetic appearance a little more. There's some very stoic women out there that'll put things off as well. But the concept becomes when you have the disease, when you start to notice the ropey veins or the spider veins, because you may have small spider veins and have large vessel disease. And if you have large vessel disease, it needs to be treated or it will progress.
You're calling this a disease.
I am.
But it is treatable and reversible?
Absolutely. It's treatable. We can stop the progression of the disease. I don't think disease as a whole is reversible, though. Once you have a disease, you have a disease.
But are there some people that once you collapse these veins, that they don't come back?
Correct. Absolutely. There are some patients where the veins will not come back. There's some patients where other types of veins may occur.
So there's a lot of people, by the way, that stand up for a living. You know, FedEx drivers, UPS, people that are walking, standing, people that work at airports, guards, just people that stand up for a living, right? People that work at a grocery store. If they have veins on their legs that they could see, right, that are popping out, chances are, if they see you, insurance covers it, you collapse those veins, they're going to have more energy.
Yes, I agree with you. 100%.
Chances are, or yes.
Yes, absolutely. They will have a better quality of life.
They don't know what they're missing?
They don't realize that they're living with this discomfort that can be taken care of because it's a slow progressive disease. If you don't realize something is hurting you, you learn to become accustomed to that, Randy. And with vein disease, it's such a slow progression that you get from having healthy legs to having discomfort, swelling, pain, edema, restless leg syndrome while you're sleeping at nighttime, to ulcer disease. It propagates, people just kind of put it on the back burner and wait till get it taken care of later on. But it's a very treatable disease process.
I guess your frustration, I don't want to put words in your mouth, is just getting the word out.
Yeah,
getting people to realize there's it's kind of an easy fix, right? Quick fix.
It's a very easy fix if you know what the disease process is. And yes, that is a frustration of mine.
Have you told me you see people like at Disneyland.
Yeah.
Have you ever walked up to anybody or ever seen somebody and you just thought, I've got to tell them. I got to help these people?
No, I've never done that.
But you've wanted to.
I would never. You know, I tell you, I've got a mixed medical cosmetic practice. On the cosmetic side of the practice, I will never tell a patient what they need to have done. I will always ask them if they have something they'd like to have done. On the medical side of the practice, with vein disease, I can ask somebody how your legs are feeling. And I've done that in the past.
Okay, so you saw somebody with ropey veins.
Yes.
And you said, are your legs tired?
Sometimes, yes. That'd be a nice way to phrase it. I've said that, yes. I've never said, though, that you've got varicose vein disease.
Interesting. Well, good for you. Now, I know you have 2 more photos. Let's take a look at
what if I can, real quickly, if you don't mind.
Yeah.
This is a great example of a gentleman who has venous disease. But you also notice this person is slightly overweight. Now, this is a catch-22. They have venous disease because they're overweight, and when you're large in the belly, it's difficult for blood to return back to the heart. He's got hypertension, he's got diabetes. His doctor asked him to exercise, but he can't because he's got venous disease and his legs hurt.
Legs are tired or they hurt?
They hurt.
Okay.
Like, they hurt. They're swollen. It's difficult to get on a treadmill. It's difficult to go out for a walk because as the day progresses, they're more and more swollen. The pressure inside the leg literally increases, and they're stretching of the skin. That stretching of the skin hurts.
So that vein that I see right there,
yes,
that's the problem.
That is the problem. That is one of the problems.
You go, I'm going to probably simplify this, but you go in, you collapse a vein.
Right.
Takes you about 15, 20 minutes.
Right.
And then it's gone. He now has legs that aren't tired.
Yeah, so if you'll allow me,
Yeah.
we actually take care of the greater saphenous vein or the small saphenous vein that's causing that varicose vein. The veins you see on your skin are treatable veins, but it's part of a plexus.
Like a deeper vein?
A deeper vein,
that's causing
exactly.
this?
Yes.
Interesting.
Yeah, so we'll take care of the vein. We'll make that patient feel better. That patient was then able to exercise. As they started to exercise, Randy, they started to come off of their medications. They came in to see me, they had 3 medications. They went down to 1 medication.
Interesting.
They looked better, they felt better, they were better. I've got one more photo for you. This is the mother of an individual who flew in from out of the country. Her son was amazed that she had lived with this ulcer for the past 15 years. Same ulcer, same spot, over and over and over again.
Like comes and goes throughout the year?
Comes and goes.
Then they put some topical on it to get rid of it?
But she wore pants, so the son never knew that she had it. When she finally came in, they saw this. Her son brought her to me. We identified the problem. We fixed the problem. The ulcer will go away. She's flying back out of the country again. We'll follow up with her to make sure she's doing okay.
And so that goes away. That went away.
That will go away.
So what do people say that have these ulcers? It's very surprising that they do nothing.
Right.
They just put cream. Do they just self-diagnose and say, I have a circulation problem? Does maybe their primary care physician just say, hey, try this topical, see if it goes away? It ultimately does go away, but it keeps coming back.
Exactly right. And same thing that I think a lot of people do is they have a little injury, they have a little, they cut themselves, they fell down, they got a little scab, they'll put some first aid cream on it. They'll bandage it, they'll kind of forget about it. It takes a little longer to heal up because they have venous disease. It comes back and they don't make the association that that recurrent injury or ulceration, if you will, is related to vein disease. If they knew they could have that taken care of and not have those wounds come back, they would have come to me the first time it presented.
Do they ever get frustrated? Do they ever confide in you, Dr. Siddiqi? I cannot believe nobody told me about this before.
100% of the time.
Do they really say that?
100% of the time. Patients come in, they're so happy after the treatment, and they say they wish they'd known ahead of time. They're frustrated because had they known, they could feel better.
So there's people that have it right now. So big ropey veins are only going to get worse. Little spider veins are only going to get worse. Come in, half an hour later, they're gone.
Absolutely.
And your legs feel better.
Your legs feel better.
So now what about other insurances? Okay, so if you have a PPO, some HMOs, what about Medicare, things like that?
Absolutely, Randy. So one of the most common causes for vein disease is age. As we get older, our veins and our valves have been fighting gravity for years and years and years. As we get older, there's a slightly higher probability of getting venous disease. Medicare does cover this.
And people need to know, it's a real interview. I'm not endorsing you here, but if somebody's going to get this done, do you have a bias? Do you believe they should go to an interventional radiologist?
Absolutely.
I mean, you have the advantage, right? I guess because you're used to working with ultrasound.
You know, as we said, a lot of doctors can treat it, but you literally have to get a needle and a wire inside of a blood vessel. I've spent 15 years perfecting that technique. So a lot of doctors can treat it. I would like to treat it in the least traumatic method for you.
Good. Now, you know we've been trying to get you on the show for quite some time. You are Orange County's leg doc.
Yes.
Do people know you? Is that OC's leg doc?
They do, yes.
Do they ever say that? Because I guess you go to the hospital, things like that. They go, oh, there's OC's leg doc? Not yet?
No, I wouldn't say so.
They will after this, by the way.
They know me as their friend.
Okay, good. So final message, somebody, again, they have big veins, small veins, their legs are itchy or tired or heavy. What do you say to them? And they're skeptical, maybe.
I would say have your legs evaluated. Come see me. If nothing else, will help you understand what's going on with your legs. I'll do an ultrasound. I'll do an examination. We'll sit down together and see how we can make you feel better.
Okay, good. I want to thank you for coming on the show. Very
Thank
good.
you.
Very good. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.